Welcome back to ABC 7 at 4. I'm Mark Ross. The number of El Pasoans living with AIDS and HIV continues to grow, which is why testing for HIV is so important. ABC 7's medical contributor, Dr. Ogechika Alozie with Sunset West Health, is here to discuss this. Doctor, I was surprised to learn 1 in 7 people who have HIV don't know they have HIV.
Yeah, and it's remarkable that that number is actually better than it was a decade ago. It used to be 1 in 3, then it was 1 in 5, 1 in 7. The goal is to get it to none, right? And so the key to that is testing. And so it's really important to test, and something we don't talk about a lot, but 60% of U.S. adults have never had a test. You may say, well, do I need a test? You may not, but 70% of those who are at a higher HIV risk have not even tested in the past year, and that's high sexual activity, younger, MSM, etc.
But the CDC says everyone should get tested.
Yeah, and that guideline actually changed a little bit. It's actually 13 to 70 as people become sexually active longer periods of their life. And so the recommendation is to get a test at least once in your life. If you're sexually active, if you have multiple sexual partners, if you're transitioning relationships, whatever it is, kind of what I call sexual health 101, and it's part of that package.
Now, unlike a COVID test, you're not going to immediately know if you're infected with HIV.
Yeah, absolutely. And so unfortunately, because you get infected, and it's not just HIV, but any sexually transmitted infection, you're not going to know the next day or the day after. And so what happens is that there are multiple different tests that have different what are called windows of infectivity when they can pick it up. The standard test that clinics like mine and other clinics use around town is what's called a NAT test or an antigen antibody lab test. Those usually pick it up within 2 weeks. Now, if you go to a rapid test at some of the clubs or a bar or a health fair, that's a little bit different, 90 days, and the sort of antibody test that you do at a local pharmacy can also be 90 days. And so we strongly recommend that you use one of the first 2 tests, and that's why you have to go somewhere where they know what they're doing.
And as they say, doctor, knowledge is power when it comes to the HIV test.
Yeah, and you may ask why. Well, if you know that you have a sexually transmitted infection, on average, human nature is that you're not going to be sexually active, you'll get it treated, and then you can encourage and empower yourself to have sexual health again. HIV is no longer what it was in the 80s and the 90s, the Eazy-E, the Arthur Ashe, the Magic Johnson days. I mean, Magic Johnson is a key example that you can have HIV, take the right medications, 90% of those medications are 1 pill a day, and live a long, unencumbered life.
And you're seeing the commercials about these medications that, if they had them 10, 20 years ago, I'm sure we'd have a lot different outcome.
Yeah, you see them at the end of football games, baseball games, they're mainstream, and it just shows you where we've come in the technology around the treatment of HIV.
And of course, let's talk about the local resources if someone needs an HIV test.
Yeah, so there's a lot of resources out there. Obviously, I'll do a shameless plug for my organization, Sunset West Health. We're really proud of the work that we've done over the last decade, and we're really excited that as we go into the fall and toward World AIDS Day, which is December 1st, we're going to have walk-in testing, and so you don't have to schedule. But again, there's a lot of options out there in the community. The most important thing, get tested, know your status, not just for HIV, but gonorrhea, chlamydia, syphilis, that sort of bundle of sexually transmitted infections to protect yourself and your partner.
ABC 7 medical contributor Dr. Ogechika Alozie, as always, thank you. And now I have a trivia question for you.
Trivia, pop quiz, let's do it.
What is the deadliest animal in the world?
I thought it was the Kodiak bear, but I could be mistaken.
Well, as an infectious disease doctor, you should know this. It's the mosquito, believe it or not. Yes.
Malaria.
How you can protect yourself and your family from this carrier of deadly diseases, that is next. We have more health news for you.
Touché.